fifth Republican in the Senate announcing he's a no on the Senate bill to replace Obamacare. He is Nevada Republican Dean Heller. He's saying it's simply not the answer, and there's nothing in the Senate bill that would lower premium costs. He joins four other Republican senators who say it's not really an Obamacare repeal. They include Kentucky Senator Rand Paul, who spoke to our own Neil Cavuto about it. Watch.
Conservatives want a repeal bill. I want a bill that looks like, feels like, and is a repeal bill. My fear is that when I look at this, I keep reading it, and it's like, it sounds like Obamacare to me. It doesn't even sound like Obamacare Light. In some areas, it may be Obamacare Plus on the subsidy side. We can't have a bill that spends more than Obamacare in the first couple of years and call that a repeal bill.
Well, the senator's father joins me now. Look who's here. He's former Texas Republican Congressman Dr. Ron Paul. Good to see you, Dr. Paul.
Hi, Liz. Nice to see you.
Is your son right?
He's always right. He's on the right track. He's had good training. I don't know all the details of this, but I know the points I've heard him say, and moving away from that and get away from the benefits to the big corporations, in particular the insurance company. Yes, he's right about that. But this is, an unbelievable task. I'm sure that nobody's going to come up with an answer. I'd like to see these 5 people get together and write a bill and then get it passed, but that's not going to happen. The big problem is the more important a service is, the less the government should be involved. But medicine is one of the most important services. Some people will say it's the most, and that's where we have the most government interference, which does nothing more than boost up the cost, makes it complicated, and then the corporations get in. Not only is it the insurance company, but it's also the drug companies, the hospital management companies, and on and on. And they all are the lobbyists that push this. So we have corporatism, and then people come along and say, we have too much freedom, and that's what the problems are. But I say we need more competition. Competition is the only thing that lowers prices. So I would like to see them just carve out some liberty for a few people who are willing to take care of themselves. Yeah,
to your point, I mean, Medicare and Medicaid dominate, I think, something like half the health market. But then the argument is, though, Dr. Paul, isn't anything better than Obamacare? That's the argument out there now.
Oh, well, it's hard to say because we don't know exactly what would replace it. There are a few things that even in the Senate bill, they try to improve it. But no, I don't expect it to be better because philosophically there's no difference, because there's too many mandates, even on the insurance company. They have all these benefits, but then they holler and scream when they have to cover things. This whole idea that people, in their 50s and 60s and 70s have to pay for OB care. I mean, somebody should say, hey, that doesn't sound quite right. That's not insurance. That's the big thing. The definition of insurance is completely destroyed when government gets involved. And it's welfare transfer payments, special benefits, but it's not insurance. And so when an insurance company gets involved, they're just getting in on the action. So that's the real problem. But Republicans, unfortunately, haven't done much better than the Democrats. They gave us the prescription health care, and some of these things are sacred now. They're not going to do this. And for somebody like myself who starts with the Constitution and says, well, where does this permission comes from? Where does this authority come from? And obviously there is none, but nobody, I bet there aren't 10 people in the Congress that say, that's right, we really don't have authority to do this. But there's hardly anything that we do these days that has precise authority, and that's why we're totally bankrupt, and that's why we're in this financial mess, which I think is going to get a lot worse.
Dr. Paul, we love having you on the show. Please come back soon.
Thank you, Liz.
Sure.